You're listening to a Raconteur Studios podcast.
Hi, I'm Dr. Emma Craythorne. I'm a consultant dermatologist, and this is the After Hours Skin Clinic. It's expert skin advice on those questions I'm always asked whenever it's outside my clinic. So in this episode, we're talking about moisturisers. And I'm delighted to be joined this time by my really great friend and fellow consultant dermatologist, Dr. Ellie Rashid.
Hello.
How are you?
Thanks so much for having me.
So Ellie's a super respected consultant dermatologist, and I'm really lucky that she's actually my partner in all of our business ventures as well. She is as obsessed with the skin as I am. And one of your particular areas of obsession is in the skin barrier and moisturising, isn't that right?
Yeah, absolutely. So love skin, obsessed with all things skin, but have a real interest in our skin barrier and how we can improve it, and how when we have different dermatological conditions that affect the skin barrier, how we can treat it.
And I suppose that's one of the key things of why I wanted us to have this conversation, because it's moisturisers that are probably really at the top of the ladder whenever it comes to trying to support our skin barrier. And there's almost so much to talk about this that we're going to divide it over 2 sessions, really. But maybe we could just start off this one, I think, by getting into the nitty-gritty of what moisturisers are.
Yeah, so first of all, if we talk about the skin barrier, these are the cells that are arranged in the topmost layer of our skin. They're arranged like a brick wall. And in the same way that a brick wall can keep moisture in the skin and doesn't let it evaporate out, if you have certain dermatological conditions, there are little gaps and cracks within this brick wall that mean moisture can escape. So when we think about moisturisers, or emollients that we call them in medicine, they're really to help to draw water into the skin. They're to help create a waterproof barrier, and also to improve the cement, so contain certain oils and things to just make up the cement of this brick wall.
Moisturisers is something that comes up in clinic all of the time, but given that this is the after hours clinic, it also comes up at parent groups, it comes up on nights out, it comes up in nightclubs, it comes up everywhere. Do I even really need a moisturiser? What do you think, Ellie?
My answer would be yes. I'm a dermatologist, but there is science to back up needing a moisturiser. So the first thing to say is there is a myth that if you weren't to use a moisturiser, that somehow trains your skin to produce more oil that will keep your skin better hydrated. But that is a myth. Your skin needs hydration. It's the first line of defence against the external environment. If you live in a city, or even don't live in a city, there's lots of pollution, you've got UV damage, etc. So I think a moisturiser is really essential to maintain your skin barrier.
I agree partly. I think that it's important to use a moisturiser every day for those people who need it. And I think that is most people. But I do think that sometimes there are some people who have much oilier skin types and they don't need it. And I also think that sometimes if we think of the place globally, in very humid situations where there's all of this increased humidity in the environment, often in those situations, some people don't require their moisturiser. So I would say that would be the only caveat to that.
I didn't think about anyone else. I just thought about us.
Global dermatology.
Global dermatology.
I think that would be my only caveat. And actually, you might even notice yourself whenever you go on holiday to somewhere that's a very humid environment, the skincare that you would have used at home, where it's typically dry and cold all the time here, then your thicker moisturising creams kind of go out the window a bit, and something a bit lighter is often needed. In some case, not at all. And I think it's also about not just the oil that you produce. That is, I think, to your point, Ellie, some people will say your skin will then make enough oil to protect itself so you don't need any moisturiser. Yes, your oil levels will change. However, it's also about how your skin is made up. So that brick wall at the surface, at the top, it's how that is made up. And, genetically, many people don't make it up very well. In fact, a whole lot of people don't make it up very well. But also, we are bombarding it every day with our cleansers, our soaps, our kind of pollution. We bombard it. So we also damage it. And I think in that regard that it's not just about making the oil, it's also about this skin barrier and how it gets made. So we think about it in a kind of three ways, I suppose, don't we, when we have a moisturiser? So you have this component that is the humectant, the area that draws in all of the water. You have this area that's the occlusive part of it that stops water escaping from our skin. And then we have the emollient element, which is all of these softening ingredients that people put into their moisturisers. So I suppose in that regard, all moisturisers are not going to be equal. And some have more occlusive things to them to stop water evaporating. A little bit like, what would that be? Something like Vaseline?
Yeah, exactly. Or Aquaphor.
Yeah, so that's loads of the occlusive agent. And then we have other things that have got lots of humectants in them, like our hyaluronic acids and our glycerins. And then some of them with these emollients, which are all the lovely ceramides. And probably a mixture of these is ideal. But in some situations, you might want to have one with a greater ratio than the other, would you say?
Yeah, exactly. So it depends on how your skin behaves. And I think people need to check in with their skin, have a look at it, see how's it behaving after you've had a shower. Is it getting really dry? How does it behave in different seasons? And then depending on the season, you might want a different type of moisturiser or emollient. Or when you're a bit more sweaty than normal, you might notice you want a lighter moisturiser, for example. About 10 years ago, we used to always say, it doesn't matter what moisturiser you use, all moisturisers are created equal. It's just whatever you like, just use that one. But actually now, I think moisturisers have really developed. It's got different ratios of those three different components that you've mentioned. So one might be better for dry skin, one might be better for sensitive skin, one might be better for oily skin. So there's a lot more nuance to moisturisers these days.
Yeah, I mean, I think that's exactly right. They've really moved on. And then as well as having this balance where we have the moisturisers with these different components of their humectants, important words, occlusive, important words, and what was the other one?
Emollients.
Emollients. Once we have this combination of these three, now what additionally happens is that companies will add other things into them as well to further benefit the skin. So I'm thinking about certain things like the microbiome support. Can you talk a little bit about that?
Yeah, so our skin is a living organ and it has a whole ecosystem that lives within it, composed of different bacteria, fungus, yeast. So some of the ingredients now that can be added to certain moisturisers can help to restore balance of that microbiome or ecosystem that lives on our skin. And some of the treatments, and we think about treatment for different inflammatory conditions that affect our skin, they can also try and rebalance that microbiome.
So when we think about moisturisers, often we'll see that there are some for the eye area, some for the face area, some for the neck, some for the body. And I get patients coming into clinic who are just super confused as to, can I just not put this moisturiser on everywhere? What's your response to that?
So before I used to say, oh, it's fine, just you don't need to have something separate for each of these. But I think now with the formulations being more refined, I think you might find that something that you would use on your body, for example, might be super hydrating and have more of an oily consistency. You might just find a bit too rich to use on your face. I personally don't treat the skin around the eyes with a separate moisturiser. I just think it's too fiddly. So I think whatever moisturiser you're using on your face, you can probably just use around your eyes as well. But I normally say to have one separate one for your face and something usually separate for your body, just because their needs are very different.
Yeah, no, I agree. I think if you can get away with using the same one on your body and your face, that's great.
Yeah,
and
perfect.
Some people who have drier skin conditions can really get away with that. I can get away with that myself personally. But for a lot of people, the facial formulations are just a little bit more aesthetically acceptable. So if you're then putting your SPF on top of that or your makeup on top of that, it needs to kind of sit nicely so that it doesn't all just, mingle in together in a poor way.
Yeah.
And sometimes for the body, you're right, we do want to have it a bit more moisturising with more emollients in it. And for some people where their skin has become a bit drier or a bit scaly or conditions like keratosis pilaris where it's a bit bumpier, you might want to have some acids and things like that in it to try and help smooth it down. So I think now in this world of moisturisers, as long as you've got those key three pillars at the top of it, there are different formulations that will suit things well. But I'm with you. I don't recommend anything different for the eye area at all. The eye is the face area. And actually, when we think about it being an area of thin skin, it's actually thicker than this area along our melolabial fold. The epiderm is thinner in this area than it is around our eye area. So I'm with you. I just keep that exactly the same.
Yeah. And also you don't want to overcomplicate people's routines and it just confuses everyone.
So we have just made this very simple subject of moisturising really complicated. It's like, okay, so what do I actually do? So because it has become so complicated, we're going to make it really simple. So the person who is potentially listening to this conversation will think, well, what do I need to buy? So what's your advice to somebody as to how do they find the right moisturiser for them? And let's first focus on the face.
So generally for the face, I recommend people use a lotion. It's a little bit lighter, often has a little bit more of the humectant ingredients, so things that draw water towards it, so things like hyaluronic acid. But some people that might be too light for their particular skin type, so they might want something like a moisturising cream, which might have more ingredients like glycerin, for example, or ceramides, just to keep the moisture within the skin. Ointments I find are a little bit too greasy unless you have a specific skin concern. I think generally for most people sort of everyday use, I'd normally stick to a moisturising lotion or a moisturising cream rather than ointment. And I guess that's something we've not talked about, but sort of the different types of moisturiser. So I normally break it down into sort of ointment, cream and lotion has the most watery content, least oil content, and ointments at the other end of the spectrum have the most oil content, so they're the more greasy preparations, and the cream is sort of a halfway house between.
So thinking about then to distill that down even further, if you, after washing your face, about 20 minutes later, your skin is feeling a bit dry and tight and uncomfortable, you probably want to be somebody who's using a cream.
Exactly.
And that's a basic moisturising cream. There's no reason here that we're saying that this has to be expensive. It has to be full of any other fancy things. This is a good basic moisturising cream. And for those people whose skin isn't really dry after they've done that little test, they want to be using something like a lotion or maybe even a gel. And actually for some people, if their skin is really quite, oily after it, I don't even recommend they use a moisturiser at all.
Yeah, exactly. And some people, particularly in the mornings, they can just use their SPF and that sort of doubles up as both their sun protection and as their moisturiser. So it's hydrating enough on its own.
Yeah. And then when we think about the body, how does somebody find a really good moisturiser for their body? And do they really need a moisturiser for their body?
So I normally do recommend something to moisturise the body with. I normally say to do it after they've had a shower. So you want to just lock in the moisture from a shower. So even whilst your skin's a little bit wet, you want to apply a moisturiser to really lock that hydration in. I normally recommend a moisturising cream, and if you need it, you might need an ointment. So something nice and thick and occlusive just to create that nice waterproof barrier onto our skin.
Yeah, I recommend a moisturising cream as well. And a bit like you've said, after you've had the shower, often the shower gels that we might use or the soaps we might use is damaging to that skin barrier, isn't it? And we're often a bit harsher with how we wash our bodies compared to how we wash our faces. And the lower legs can often get dry for people. And particularly as we age, that dryness becomes more evident. So I love the tip so much of when your skin is still wet, that is whenever you put your moisturising cream on. In fact, I'll often tell my patients, keep it in your shower with you. Just keep it in there. And when you switch the shower off, shake yourself down like a dog and then apply it. And then when you step out of the shower, you can pat yourself dry and then get ready straight away. So, I'm all about time saving in the morning. And I think that helps out a lot of people.
Absolutely. And if anyone has young kids, I always have a moisturising lotion, moisturising cream in the bathroom, because you get the kids out of the bath and you just dry them off, and then you can just do it all whilst they've got no clothes on.
I suppose it's worth having a conversation as well about, there's a huge array of moisturisers on the market and they're all at very different price points. There's many of them saying they claim to do this, they claim to do that, and some of them are outrageously expensive as to what they are. What do you think about these very expensive moisturisers? Is there a need for them? Have they got any additional benefit compared to the more basic ones? What's your thoughts?
So my thoughts are that it's all down to personal preference. So they have different textures. Moisturisers will have a different feel. They'll have different fragrance chemicals added to them. And so some people may prefer the experience of a more expensive cream, but I don't think that you need to use a more expensive cream. I don't think it confers any additional benefit compared to a better price point cream. So I don't normally ask my patients to go and get something that's hugely expensive. But if they've got something that they really like, that they've been using for years, and it does cost a lot of money, then fine. If you want to do that, you can carry on doing it, because it is about an experience, and you have to enjoy putting the moisturiser on your skin. You have to like the feel of it, how it feels when you put it on, how it feels after you've put it on. So if you achieve that with something more expensive, fair play. But I wouldn't normally recommend it. I think you can achieve just as good benefit with the cheaper options.
So the functional outcomes are going to be exactly the same, but it just might be your experience, and having a prettier bottle on your shelf is the reason why you're paying that extra money.
Completely. So Emma, a question I get asked all the time is it worth spending my money on an anti-aging moisturiser?
Total bullshit. No. First of all, the term anti-aging is one that could be left in the past. I think it's a terrible term.
Terrible.
I just hate it so much. The idea of anti-aging means that you're dead, so you're not going to age anymore. So no one wants that. I think the term better aging is a better term to be using, because we want to help our skin and our organism as a whole age as well as it can do. But in truth, these better aging moisturising creams, the answer to that is really no. They are not going to make your skin age less, because we know that there are certain components, certain ingredients that can be used to, I suppose, effectively reverse age the skin a little bit, but they are not available in the quantities that you would be able to buy in an over-the-counter pot of moisturising cream. And most of them are restricted by their need for a prescription, these ingredients. And therefore, being able to just get them in a pot over the counter will never happen. So there is no point spending your money on moisturising creams with that promise. The best moisturising cream that you could probably buy to better age or reverse age the skin is available as a broad spectrum SPF 50, and that will work. But the moisturising creams, the answer to that is definitely no. And if you need something with these stronger ingredients, well, that's something that does require a prescription. There's a few terms that people might see whenever they are picking up moisturiser, and I thought it might be worthwhile discussing some of those so that people can understand whether it's a benefit to them to have these terms or not. And one of the terms is the term dermatologist-tested. Does that make it a better moisturiser?
So dermatologist-tested is a claim that's put on there, and it normally endorses a product. So it adds some level of credibility to a product. But you don't really know how that testing was done. It just means that a dermatologist was involved at some point during the formulation and the testing of that product.
So even if the dermatologist tested it and hated it, they could still write dermatologist-tested.
Exactly.
Okay. And what about the words non-comedogenic?
I like it when moisturisers will put that on there. So that term non-comedogenic means that it doesn't clog pores. So pores are the little openings out onto the skin where you've got the oil hair unit underneath. And things that can prevent that from getting clogged up are non-comedogenic. So it doesn't mean that it absolutely doesn't clog anything up. It just means that it has more non-clogging tendencies.
Yeah, so the term actually, whenever they related it back, you can look online and see a list of all the ingredients that potentially might block your follicles. And if these ingredients block the follicles, then it gets a high number. And if it doesn't, it gets a fairly low number. But what that also doesn't really do is tell you what it's like whenever those ingredients are in a formula together. So it's sometimes not that accurate. And the term then also came from the original components of it, which are related to it not blocking the follicles on rabbits' ears. So the study was all done on rabbits as opposed to humans. So whenever we see that term, that was what the original study was.
I've never known that.
Yeah. So it's all about rabbits. But I think that it can be a helpful guide. I do agree for my rabbit. What about the term clinically proven?
Yeah, so clinically proven just means that there's been some degree of testing that the claim that is made is valid, but it doesn't give you any information about to what extent that claim is valid and to what degree that benefit. So say it says, excellent for eczema. It might mean that it's just been tested on people that have eczema, but it doesn't necessarily mean that it's done an exceptional job in managing people's eczema.
Yeah, I mean, I'm with you. I think all of these terms, they just kind of are taking up advertising space, really.
Yeah, it's all marketing, isn't it?
It's all marketing. There are some things to look out for in moisturisers that would actually make a bit of a difference in terms of how good they are. And you'll see terms like ceramides put onto things, and that falls into this emollient bracket. But actually, it's not just about the ceramides. It's about the types of ceramides that they are. It's about the concentration of the ceramides. Because, in fact, if that ratio isn't quite right, then actually it can be slightly more detrimental than it can be beneficial. And people will be making these smart moisturisers that will have sun filters in them. And again, this is probably an important point because they might say this can replace your SPF, and it might say SPF 50. But in reality, if we're putting moisturisers on our face, we want to be putting them on often to protect against UVA rays. And, you know, the company's under no obligation to put that UVA status on it. So that's something that is beneficial, yes, but actually might again trick you. And then other things that get added in are peptides. And this is a whole new world of potential skin benefits or skin absolute nothingness, considering what the peptides are that are put into it. And again, the studies on these are not particularly big studies. It doesn't mean that they're not going to work, but the studies really don't convey that benefit that we might necessarily expect from it because these things are not in the right concentrations. So I think that if we're looking for a good moisturiser, we want a simple, straightforward moisturiser. And if we want these additional benefits that we might get from things like peptides or from SPF filters, that we really understand that they are there in the right concentrations and not just as a simple marketing term, I think. So let's get on to then thinking about what our top 3 moisturisers might be. So we've made the simple subject, as I said, really confusing, but we're now going to make it really simple and just tell you what to go and get. So let's think of the person for their face, and they might have skin that's oily, but they still feel like they need a bit of moisturising. What kind of moisturisers do you typically recommend for that?
So I normally recommend a moisturising lotion, and the one I usually recommend is the CeraVe moisturising lotion. It's particularly good if you've got a dry scalp, you know, people that have short hairstyles and their scalp can get a little bit dry. Like my brother uses it on his shaved head all the time. So yeah, it's a nice product, nice and light, a little bit of moisture, don't need too much. Perfect.
And if somebody has, let's think about now, a skin type that does need a bit more moisture. So often around kind of menopausal time, people even who, well, I say people, but clearly women, who would have perhaps had oilier skin, but their skin becomes drier usually around that time. And often we can find that the skin barrier is slightly changed and you do need a bit of extra moisturising. What moisturiser do you typically recommend for that skin type?
For that skin type, I'd either recommend something like the Roche-Posay Toleriane range. I also recommend the Eucerin Hyaluron-Filler range.
I love the Roche-Posay Lipikar Balm AP+M.
Love that for the body. I don't use it on the face, though.
Love it for the face.
Really? I find it too rich for my face.
Yeah, love it for the face for people who need to get that extra moisturising in. And it tends not to leave too much of a greasy kind of shine on them. But I really love, that would be my top one for that group.
That's what I use on the kids.
Yeah.
On their face.
Yeah. And then, do you have any tips on how you would apply your moisturiser?
Yes, so my tip for applying a moisturiser is out the shower, skin still wet, to really lock in the moisture. When you've got the moisturiser on your hands, you just want to warm it up in the palm of your hands and then almost like press the moisturiser into your skin. And then the strokes that you want with your hands isn't this rigorous circular motion. You want to just do it in a sort of up to down motion, usually in the direction of hair growth. That's so that you don't get irritation of your hair follicles. And if you're using quite a thick, oily, sort of occlusive product, then sometimes you can get some irritation around the hair follicles, something called folliculitis. So try and reduce the risk of that. You just want to press the moisturiser into your skin and in the direction of hair growth.
There's a big trend just to do pat, 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 isn't there, on the face? Little dots and gentle application of it to the face, as opposed to the just whack it on your hand and push it right across your face, which I do, actually.
I do.
So what would be your top 3 moisturisers?
My top 3 moisturisers, so moisturising lotion would be CeraVe moisturising lotion. My top moisturising cream would probably be La Roche Lipikar AP plus M, and my top moisturising ointment would either be Hydromol or Epaderm or Cetraben Ointment. So they're the ones that come in the tub, quite lardy, very thick, very occlusive.
Well, you're still one of my top three, because I would also say one of mine is the La Roche-Posay Lipikar Balm AP plus M. I just love that. It also comes in a light version, so you can get a light form of it and the cream form of it. I only found the light version whenever I was in Colombia and I saw it in a shop. And I thought, oh my gosh, the shop was closed. I had to go back the next day to get it.
I didn't know.
Yep. Gorgeous consistency. So that comes in two forms. I haven't seen it in the UK yet, but I will be looking out for that. For people who have sensitive skin, those prone to things like perioral dermatitis or skin sensitivity and looking for a lighter one, I again like the La Roche-Posay, the Toleriane in the gel or the cream is just really, really lovely for the skin. And I do love the Bioderma Atoderm. I think it's a really great, gentle and moisturising cream for face and body, especially for children. Well, Ellie, thank you so much for joining me in this episode where we attempted to simplify moisturisers but succeeded in making it a lot more complicated. But then we did bring it back and realise that I suppose the key things to remember about a moisturiser is, number one, that they're not all created equally, and that the consistency of them is so important about how you want to use this on your face, whether this is an ointment all the way through to the more gel liquid forms. And then remembering that this is this combination of things, so these occlusives, these humectants and emollients. And then sometimes there's additional benefits of things that are put into it, like some active ingredients to support the skin microbiome. Sometimes there's sun filters are put into it as well. So we do have these quite smart moisturisers that we can use on our face now. But I think we both think that probably finding the right moisturiser for your particular skin is key, and realising that it doesn't have to be an expensive one. Usually the job of these moisturisers is to moisturise, so simple is usually best.
Absolutely.
So don't forget to look out for our Moisturisers Part 2 episode, because clearly there is a lot more to discuss. And in that particular episode, we're going to think about moisturisers and how we specifically use them when we're treating people with eczema. So take a moment now to click on the subscribe button if you haven't already, and it will pop up like magic in your feed. See you next time on the After Hours Skin Clinic.